I'm Dwayne Brown. Tonight on KPBS Evening Edition, mothers-to-be taking charge of their health.
Wisdom and common fears and common concerns and common excitement.
The benefits of a new model of prenatal care and how it may replace individual visits to the doctor.
And on the eve of the 50th anniversary of the Voting Rights Act, another legal challenge to the law. I'm Peggy Pico with an update and what's next for California voters. But first, more library hours or perhaps a few more firefighters? What else the city could buy with millions of public dollars being spent in an attempt to keep the Chargers in San Diego.
Infinite Jest really did it for me, and it's a challenge. I mean, it's 1,000+ pages and it's hard, and sometimes you want to throw that book against the wall, if you're perfectly honest.
A road trip with a literary legend, the comic actor stepping into his shoes with help from a lo-fi gadget. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. UC San Diego has suffered a big blow in its fight with USC over a large Alzheimer's research project. The drug maker Eli Lilly plans to move its money for a key part of the project to USC. From our North County Bureau, KPBS health reporter Kenny Goldberg explains.
Lilly planned to give UCSD up to $76 million to manage the nationwide trial of an experimental Alzheimer's drug. Lilly's decision to switch the money to USC follows a similar move by Dr. Paul Eisen. He directed the research at UCSD until just a few months ago, when he left to join the other school. Eisen says Lilly's decision is a win for the study and for the field. UCSD officials call Lilly's move unfortunate, but they point out the drug trial is only one part of their Alzheimer's research. On Tuesday, a Superior Court judge issued a preliminary injunction ordering USC to return data and computer systems it had taken from UCSD's Alzheimer's project. That data is crucial in the fight between the two universities. Kenny Goldberg, KPBS News.
Talking trash in San Diego, 910,000 tons of waste gets tossed into our Miramar Landfill every year. The dump was supposed to close in 2022, but a new plan could change that. Equipment operators, supervisors, and workers at the landfill created the trash compaction plan and submitted it to the city through managed competition.
What we're doing today is we've actually introduced a second compactor. They're actually compacting on a flat surface, horizontal surfaces, and there's more passes of the trash. That's generating flatter lifts, which we refer to as a pancake, and that's creating additional compaction and more space.
The plan increases the landfill's capacity to more than 11 million tons. Combined with San Diego's recycling plan, the city expects Miramar to stay in operation until 2030. That's an additional 10 years. Paying more for water in San Diego, city council members are reviewing a plan to raise rates by nearly 17%. Public Utilities Department told city leaders today the rate hike would cover the loss of money from customers who are using less water due to the drought. The utility also cited extra expenses, including the higher price for importing water from Southern California and the new desal plant in Carlsbad. Trying to keep the Chargers in San Diego, we already told you about county supervisors voting to spend more cash on stadium consultants, but one city official tells Peggy Pico the money could be spent elsewhere to benefit San Diegans.
First, San Diego City Council approved more than $2 million for an expedited environmental impact report to replace Qualcomm Stadium. Then on Tuesday, county supervisors approved another $500,000 of public money to retain experts. The projected total cost of a new stadium in Mission Valley is over $1 billion. Here with a look at who's opposing the funding and where else that money could be spent are my guests, Voice of San Diego's senior reporter Liam Dillon and San Diego City Councilwoman Marty Emerald. And Marty, along with council members Todd Gloria, David Alvarez, you voted against funding for this expedited EIR. How come?
It's good money after bad. The Chargers have said that they're done with San Diego. They have turned their attention to Carson. So we're essentially, preparing an EIR to negotiate with ourselves? Not good policy. We could spend that money on important public services, and I think we need to refocus as a city on our mission of serving communities and allow the Chargers to make the best decision for them, make the best decision here for taxpayers.
Now, where is that $2.1 million coming from, and how else, you touched on it, how else would you like to see it be spent?
That money is reimbursing the city the cost of administering state-mandated programs. So this is money we have spent and the state is reimbursing us. So to say it's some unexpected gift is a fairy tale. This is money that we've already spent and that we needed back into the system. $2 million could go a long way. I know Liam's got a list, and we do too. We could buy a couple of fire engines. We can increase recreation library hours. We can help to recruit more police officers.
Sure. Let me touch with Liam on that, because
lots of good things we can buy with $2 million.
You actually, in your article, specifically laid out what that would buy. Give us some examples.
Sure. So for a year, we could increase library hours by 4. We could increase recreation center hours by 3. With this $2 million, there's a number of things we could do as far as increasing emergency response services in some of the communities that need it the most. And so that's not to say that spending money on football isn't something that the city may eventually decide to do, that public wants, but it has to be held in context of what else we could be buying with the money that we're going to be spending.
The reimbursement money. And Liam, now, the Chargers' impact on San Diego as far as economic, can you remind us of what kind of economic impact they do have here?
Sure. So economists have said over and over again for a number of years, it's fairly unanimous that sports stadiums have a negative or neutral economic impact on the city. As many times as people are going to say this stadium or this team will make money, it makes sense economically, that's not true. So that's just the reality. Again, if we want football, we're going to be paying extra for it.
And Marty, you're nodding your head on that.
Oh, absolutely. This makes economic sense for the Chargers, because a new stadium would increase their net worth and make them more valuable if Dean Spanos decides to put them on the market. But the city won't get anything out of it. In fact, at Qualcomm, we're still subsidizing Qualcomm to the tune of $10–11 million a year. It's a money pit.
The old Qualcomm Stadium.
Right.
Let me ask you this,
and a new stadium, there's nothing to suggest that it's going to be any different from sports venues built anywhere around the country that are either economically neutral or an expense to taxpayers.
Let me ask you this. I'll start with you and come to you, Liam. Is there an upside? We've heard about the downside of the Chargers leaving, as far as people not being able to do parties and bringing things together and sort of this team spirit for San Diego. But is there an actual upside for the team leaving?
Not economically, not to taxpayers who are relying on government to spend their money improving the quality of life in our neighborhoods. I guess a psychological, emotional aspect. There are some dyed-in-the-wool Charger fans. My husband has grown up with the Chargers, and we all love them. But, we've got to make a good business decision on behalf of the people of the city.
I guess that's what I'm asking, business-wise or otherwise. So we talk about, okay, if the Chargers leave, is there a good side to that?
Oh, so if your question is where the city benefit in any way if the team does leave, well, we have 167 acres in prime real estate in Mission Valley that we could do a lot of things with, whether it's new development, which would add new taxes to the city's coffers, or whether it's a new riverfront park that a lot of folks have been advocating for in that area. Sure, or even SDSU expansion. There are a lot of things that could be done with that land if football isn't there.
Okay, in the 30 seconds left, Marty, why do you think Mayor Faulkner is fighting to keep the Chargers here?
I think that Mayor Faulkner is in a very difficult position. He's damned if he does, he's damned if he doesn't. And so he's trying to navigate a minefield of politics here with pressure on both sides. And I'm sure that he doesn't want to be the mayor who let the Chargers get away. However, he campaigned saying that we need to reinvest in our neighborhoods. I believe in that too, and I believe in what he had to say, and I want to be a partner with him to invest in our neighborhoods.
All right.
Not in a football team.
Okay, we have to leave it there. Councilwoman Marty Emerald and Voices of San Diego, Liam Dillon, thank you so much.
Thank you.
Helping you help veterans, the goal of a national nonprofit group based in San Diego. Its mission, help civilians fill a major gap in caring for vets. Psych Armor Institute offers free education, counseling, and support services to those who work, live, or care for military veterans. Today, state, city, and federal officials joined together to highlight the group's new helpline.
PsychArmor Institute's free call center and programs for employers fill this vital need. Not only will the call center provide a new resource, but PAI's programs directed at employers from across the nation will help veterans transition to civilian life.
The helpline is a place where employers, teachers, spouses, and friends can go for advice on how to effectively help vets. You can reach them at 844-PsychArmor. As Tijuana enjoys a spike in visitors from San Diego, businesses north of the border are suffering. KPBS Fronteras reporter Jean Guerrero says the plummeting value of the Mexican peso is to blame.
In San Isidro, most shoppers tend to come from Tijuana, but business owners say it's become a ghost town in recent weeks. Clothing vendors are among the worst hit. Luz Maria Caballero is manager of a San Isidro dress store called Princesa. She says sales have plummeted alongside the weakening peso. More than 80% of Princesa's clients come from south of the border.
The purchasing power is less, so it's harder for people to buy dollars to come spend money here in the U.S.
Mexico's peso is trading at 16 per dollar, the lowest exchange rate in 22 years. That makes it harder for Tijuana residents to afford shopping in dollars. Princesa sells dresses for formal occasions like weddings, quinceañeras, and baptisms.
Our sales have fallen about 50% so far this month.
The Mexican government has been increasing its dollar auctions to try to support the weakening peso, but the depreciation isn't expected to let up anytime soon. Jean Guerrero, KPBS News.
A positive ID on an airplane wing. Experts in France say the fragment came from Malaysia Airlines Flight 370, which disappeared more than a year ago. What may be the first piece of evidence in the investigation washed up on the Indian Ocean island of Reunion a week ago. Experts are analyzing the metal with high-powered microscopes to figure out what caused the plane to go down. The Beijing-bound jet had 239 people on board when it veered off course in March of last year. A battle brewing on Capitol Hill over President Obama's new rules on power plant emissions. A Senate committee approved legislation to block President Obama's plans. He announced new rules Monday to fight climate change by cutting emissions 32% by 2030. 15 states are preparing to challenge the regulations, arguing they exceed the president's authority. California health officials have issued a warning to pregnant women about the dangers of whooping cough. The disease is especially dangerous for infants. Pregnant women are urged to get the pertussis vaccine in their third trimester. The shot can offer their newborns some short-term protection. So far this year, more than 3,400 cases were reported in the state. A new model of prenatal care that could improve the health for mother and child and replace individual visits to the doctor. KPBS health reporter Kenny Goldberg explains.
At the Chula Vista office of the San Isidro Health Center, a group of mothers-to-be are taking charge of their health. As one woman checks her blood pressure, another tests her urine for signs of excess sugar or protein. The women also spend a couple of moments with a medical resident who measures their tummy and monitors their baby's heartbeat. The women record all of the numbers in a notebook. Then they sit around in a circle and share their feelings about breastfeeding. Scripps family medicine doctor Shayla Serpis facilitates the meeting with a light touch. Dr. Serpis explains this model of care is called centering. It brings together pregnant women who have a similar due date. The group functions as a support system.
So they grow together, they share experiences. Women are sometimes new, first-time moms, and other women have had experiences, so they share wisdom and common fears and common concerns and common excitement.
The centering program starts around the second trimester and goes through delivery. Each 2-hour session covers different topics based on how far along the women are in their pregnancy. But it's not a lecture series. It's a series of group discussions. By taking part in these and other activities, women gain more understanding about their own health.
So, for example, they weigh themselves, they graph their weight, and they self-reflect on how their weight gain is. Rather than just the doctor saying you're gaining too much weight, you're gaining too little weight, they can self-reflect and identify if they're on track with their growth and what changes and goals they can set for themselves to improve their overall health during their pregnancy.
Centering takes the place of regular one-on-one prenatal visits. This kind of group health care can save clinics money. But second-year medical resident Karen Law says it has another, more important advantage over a typical doctor's visit.
I think the group setting is great because it provides a longer time frame for women to have their questions answered, and topics might come up that they would not have even thought of themselves, or that I would not have time to address in a short 15-minute session. But having the 2 hours gives you a lot of flexibility.
Anaisa Dearte has the earliest due date of anyone in her centering group. She's due on August 19th. Dearte says the other women have been terrific.
Like sometimes I feel something weird, or I feel sick or something, I just call them and they help me.
Scripps and the San Ysidro Health Center have collaborated on the centering program for 6 years. About 150 women have taken part. Compared to women who get one-on-one prenatal care, centering participants tend to have higher rates of breastfeeding, more appropriate weight gain during pregnancy, and have higher use of long-acting contraceptives after delivery. Scripps family medicine doctor Carla Garcia says this model of group care could be used to help people manage their diabetes or hypertension.
At least for our patients here, they love to talk and they love to interact with each other. It makes it easier for them, I think, to express themselves, and then at the same time it makes it easier for the provider so that we don't have to keep repeating the same thing over and over every visit. I think, the way our healthcare system is, definitely it's going to be a bigger part of our primary care for sure.
The American Academy of Family Physicians says nearly 13% of its members conducted group visits in 2010. Kenny Goldberg, KPBS News.
This just into our newsroom, a judge has found Southern California Edison executives engaged in improper talks with state utility regulators connected to the now closed San Onofre nuclear plant in the North County. Today, the Public Utilities Commission said the company could face potential penalties in excess of $34 million. At issue were private discussions around the possible division of costs from the now defunct plant. The settlement had consumers paying more than $3 billion. A federal appeals court struck down a Texas voter ID law today, ruling the Republican-backed measure violates the Voting Rights Act. Peggy Pico has an update on voter rights in California.
California celebrates this week's 50th anniversary of the Voting Rights Act by restoring voting rights to tens of thousands of felons who served their time. But voting rights continue to be challenged in other states. Here with an update on voting right challenges and what's next in California are my guests, State Assemblywoman Dr. Shirley Weber, representing San Diego's 79th District, and Lori Schellenberger, Voting Rights Director with ACLU of California. And Dr. Weber, the Voting Rights Act is a historic civil rights act as well. Remind us of what it did.
You know, the importance of the Voting Rights Act of 1965 was really to remove the barriers to voting. The right to vote was always there, but the fact that people had poll tax, literacy tax, all kinds of things that put in the way that a person could not register to vote. So in the South, millions of individuals were disenfranchised because they couldn't pass a literacy test that asked them what was in the Constitution down to the most finite aspect if they were African American. And yet the literacy test for someone who was white might be, what is your name? And so as a result of that, we only had about 7% of all of the folks in the South actually registered to vote and could participate.
And it changed, and after the changes, more African Americans ran for office, won elections, changed drastically. So how has this demographic shift changed California's political landscape?
Well, you know, California always had the right to vote and didn't have the same kind of barriers, although we did have some other things in gerrymandering that took place. But it truly opened the door for people to, one, for the right to vote. It gave them a voice in their own community and the running of their communities. So you see more elected officials at the local level, whether it's school board, city council, state assembly race. We now have 12 African Americans in the state assembly. I think close to 20 or more Latinos in the assembly and the Senate. So we see the diversity that is there as a result of the right to vote that's there and the empowerment empowerment of individuals.
Well, something new that happened this week, Lori, the expansion of voting rights to some felons in the state. Who does this specifically apply to, and explain to us how that works?
Sure. The law in California since 1974, voters passed an initiative to expand voting rights to the formerly incarcerated. So the only people who were not allowed to vote in California were those who were currently in prison or on parole from prison. A few years ago, the state passed a new Sentencing Reform Act that created a new category of sentencing for low-level offenders who were committed to community supervision, not state supervision. And the former Secretary of State issued a directive saying those people can't vote. The ACLU filed suit. We won that case, but the former Secretary of State continued to challenge it. Yesterday, the new Secretary of State, Alex Padilla, removed that challenge and re-enfranchised about 60,000 Californians.
Another key provision of the Voting Rights Act was struck down by the Supreme Court, U.S. Supreme Court, 2 years ago. What was that key provision, and how did that change things?
Sure, there were two components. Really, the first initial components of the Voting Rights Act. One was to make it easier to challenge bad voting practices. But really, the heart of the Voting Rights Act was what we called the pre-clearance provision, which required states with a history of discrimination, 15 states in this country, to get permission from the Department of Justice before they initiated any change in their electoral practice, whether it was the hours that your polling site was open or a redistricting plan. And that was a key provision. There were hundreds of laws that were kept from being enacted, bad practices going into practice. As soon as that was struck down, 10 of those 15 states passed horrible restrictions on voting, voter ID, cutbacks in early voting that have really changed outcomes.
And some of those have been challenged. Texas, of course, federal appeals court just today said that their law was discriminatory. So they changed that. But Dr. Weber, talking about California, what do you see as far as needs or the future of voting rights here in this state?
Well, clearly, we need to obviously expand the hours of our voting for Californians. We see that when we do expand those hours, people vote, and we need to be sensitive to that. We can talk about basically increasing the number of polling places so that people don't have to stand in line so long, those kinds of things. We surely have to get information out to those who are ex-felons that they have the right to vote, because even though California doesn't keep you from voting once you've served your time, people believe they don't have the right to vote. Consistently, we hear that from not only those who are ex-felons, but we hear it even from probation officers. We hear from individuals who should know better, even elected officials, that once you've committed a crime and you've done your time and you've done all those things, you have the right to vote. We would love to see our probation officers, our parole officers, that when time is up, that they sit down and say, you now have the right to vote. Give them that card and register them to vote. Sounds like a simple thing. We tried to get it done last time in the Assembly. People fought it, said it was too expensive. Those kinds of things. But we'd love to see that.
A few areas to work on for the future. State Assemblywoman Dr. Shirley Weber, thank you so much. And also ACLU's Lori Schellenberger, thank you.
Thank you.
Thank you.
Actor Jason Segel talks about the challenge of his latest movie role. He plays a celebrated writer whose life came to a tragic end. KPBS arts reporter Beth Accomando spoke with Segel about the new film, End of Tour.
David Foster Wallace's novel, Infinite Jest, garnered wide acclaim back in 1996 when it was first published. It also caught the attention of actor Jason Segel.
And it's a challenge. I mean, it's 1,000+ pages, and it's hard. And sometimes you want to throw that book against the wall, if you're perfectly honest. But getting through it makes you feel smart. It makes you feel like you've accomplished something. And that's part of his intent, is to remind you, like, no, you're capable. You're capable of this.
Segel now plays Wallace in the new film, The End of the Tour. The film is based on the book by Rolling Stone writer David Lipsky, who spent 5 days interviewing the author during a book tour for Infinite Jest.
When I think of this trip, I see David and me in the front seat of his car. He wants something better than he has. I want precisely what he has already.
I had access to David Lipsky's tapes from this interview, which was really, really helpful. What struck me most from listening to the tapes was that for as weighty as some of the moments were and some of the discussions, there are also 5-minute mundane conversations about what's on the radio. And that was really important taking into the movie, because you need to want to be in the back of the car. And luckily, in listening to the tapes, it was the most interesting road trip I've ever taken part in.
I'm sorry, man.
What's wrong?
It's just you're going to go back to New York and, like, sit at your desk and shape this thing however you want. That, I mean, to me, it's just extremely disturbing.
Why is it disturbing?
because I think I would like to shape the impression of me that's coming across. Yeah. I don't even know if I like you yet. So nervous about whether you like me.
But can someone who's never read any of Wallace's books still appreciate the film?
If you know who David Foster Wallace is, and if you know who David Lipsky is, it adds to the fun of the movie because you're sort of familiar with the themes. But what I think the movie is really about has nothing to do with David Foster Wallace or David Lipsky. I think what the movie is about is this terrifying moment when things go as well as they can possibly go, and you realize you still feel the same.
I think that if there's a sort of sadness for people under 45, it has something to do with pleasure and achievement and entertainment, like a sort of emptiness at the heart of what they thought was going on.
I think that you walk away from the movie with some really interesting conversation to be had.
The end of the tour serves up Wallace as an engaging, complex, and troubled man, and it offers insights into why he chose to leave this world at the age of 46. Beth Accomando, KPBS News.
Hot and steamy in San Diego with a chance of some showers tomorrow. Lightning and scattered thunderstorms possible along the coast. Temperatures in the 70s. 80s for the Inland Valley area. Warm in the mountains as well, with the weather clearing up by the weekend there. Some rain also possible in the desert with a high tomorrow of 111 degrees. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. You have a great night.